Hello, and welcome to this online presentation by the Kentucky Home Birth Coalition. My name is Jennifer Olagus, and I'll be talking a little bit today about our goal to license direct entry midwives using the Certified Professional Midwife credential. First, I want to give you a little bit of background about home birth in Kentucky. According to a recent CDC data brief, the percentage of home birth in Kentucky has grown from 0.64% in 2004 to 0.9% in 2009. This is a significant increase in just 5 years and is consistent with the national trend of growth in home birth. Kentucky's percentage of home birth is above the national average of 0.74%, and around 500 babies are born at home each year in Kentucky. Most of these home births are attended by direct entry midwives or certified professional midwives, who are direct entry midwives with a national credential. Just to clarify, there are two types of midwives who can attend home births. Certified nurse midwives, who mostly work in hospitals, are also able to attend home births, and there are a few CNMs attending home births in Kentucky. But the majority of home births are attended by direct entry midwives. These are midwives that do not have a nursing degree but are trained in out-of-hospital midwifery care. Direct entry midwives are currently practicing illegally in Kentucky because there's no route to licensure. These Kentucky families who are choosing to birth at home need access to legal and licensed care providers to attend them. Who are these women that are birthing at home? Women who birth at home are seeking a physiologic birth without unnecessary medical interventions that are so routine in the hospitals. The CDC reports that home birth is more common in women ages 35 and over, as well as women who have had previous children. Kentucky families choose home birth for religious, ideological, cultural, and economic reasons. The current administrative regulation regarding midwifery that's on the books is entitled Lay Midwifery. This regulation issued permits to midwives practicing through the health department. It hasn't issued any new permits since 1975 and prohibited midwives from carrying medications, drawing labs, doing internal exams, and performing newborn screening tests. We do not want to renew issuing permits under this regulation because it is very outdated and it does not reflect how the modern midwife practices. Since 1975, with this regulation, home birth midwifery was pushed underground, making it a misdemeanor or a felony for practicing medicine without a license, and left midwives with no oversight or accountability. Now we're going to talk a little bit about certified professional midwives and the CPM credential. CPMs are nationally credentialed midwives. The CPM credential has been in use since 1994 and is issued by NARM, the North American Registry of Midwives. The CPM credential receives its accreditation by the National Commission on Certifying Agencies, the same organization that accredits the Certified Nurse Midwife credential. CPMs receive a competency-based education, meaning that more emphasis is placed on the skills acquired than the hours in a classroom. Candidates to become CPMs must prove extensive didactic achievement in midwifery and related subjects. They must document a large number of verified, supervised clinical experiences in an out-of-hospital setting, meaning in a birthing center or the home. They have to pass a rigorous 7-hour examination as well as a hands-on skills assessment. All candidates for becoming CPMs must also have up-to-date CPR and neonatal resuscitation. This chart outlines the minimum clinical requirements for certified professional midwives, certified nurse midwives, and family practice physicians, the 3 maternity care providers that have historically attended home birth. In this chart, you can see that the minimum clinical requirements for the CPM exceed those for the CNM and the family practice physicians in all but one category, and that the CPM is the only maternity care provider that is required to have out-of-hospital birth experience. CPMs are highly trained maternity care providers and are the experts in out-of-hospital birth. CPMs provide care within the midwifery model of care. They're primary maternity care providers that work autonomously, meaning that they do not have to work under the supervision of a physician. CPMs provide holistic care to their mothers, meaning that they care for a woman's physical, emotional, and psychological health. CPMs are specialists in out-of-hospital birth working in freestanding birth centers and homes. Women who receive care from CPMs have much lower rates of cesarean section, unnecessary interventions, and birth trauma, and much higher breastfeeding rates. Now we're going to talk a little bit about the safety of birth at home and the safety of out-of-hospital birth. These are just a handful of the scientific studies that have shown that home birth is safe. Home births have equal or better outcomes for healthy women experiencing normal pregnancies. And many of these studies also show that qualified birth attendants are key to good outcomes. The CPM 2000 study was the largest study ever done of CPM-attended home births. It included over 5,000 women who planned to give birth at home. And a summary of its results are that there were no maternal deaths, that intrapartum and neonatal mortality was consistent with low-risk hospital births, and that the intended home birth group had much lower rates of medical interventions. Kentucky Home Birth Coalition believes that licensing midwives in Kentucky will help increase access to midwifery care for those families birthing at home and ensure competency of the midwives practicing in our Commonwealth. This diagram shows the licensing trends for direct entry midwives. In the 70s, there were no laws licensing direct entry midwives. And by 2010, at least half of the states had laws in place for licensing midwives. CPMs practice legally in 28 states, the most recent being Indiana, who passed a law allowing CPMs to practice a little over 3 weeks ago. The CPM credential is used for licensure in 25 states. Using the CPM credential as a baseline for licensure has become increasingly popular because it keeps states from reinventing the wheel. Formerly, states had to use their own requirements for licensure, their own educational requirements as far as testing, clinical requirements, and now the CPM credential is used in place of those as the baseline for licensure. Our neighbors in Tennessee, Missouri, and Virginia all license CPMs, and no state that has licensed CPMs has ever rescinded its program. The Kentucky Home Birth Coalition had a bill introduced in the Senate in the last legislative session. Our bill was introduced by Senator Buford from Jessamine County and was directed to the Health and Welfare Committee in the Senate. It did not receive a hearing in the last legislative session, but we have plans to introduce a similar bill in the Senate and the House in the coming session. Our bill licenses direct entry midwives using the CPM credential and creates the Kentucky Board of Midwifery, who will be responsible for creating regulations in accordance with national midwifery organizations, issuing licenses, renewing licenses, and providing oversight and disciplinary actions when necessary. There's growing support for midwifery nationally and internationally. The American Public Health Association released a policy brief in 2001 stating that they support increased access to out-of-hospital birth, licensing of direct entry midwives at the state level, public and private insurance reimbursement of midwives, the addition of the CPM as a separate category of certifier on birth certificates, and increased funding for ongoing research into outcomes and safety of out-of-hospital birth. The World Health Organization has been a long-time proponent of midwifery care, stating that midwives are the most appropriate primary care provider to be assigned to the care of normal birth. The Milbank Report on Evidence-Based Maternity Care recognizes the CPM as the benchmark for low intervention and good outcomes. The Royal College of Obstetricians and Gynecologists in the United Kingdom, which is the equivalent to our ACOG here in the States, put out a joint statement with the Royal College of Midwives stating that there is no reason why home birth should not be offered to women at low risk of complications, and it may confer considerable benefit for them and their families. We believe that licensing direct entry midwives in Kentucky will ensure access to quality midwifery care for those families that are choosing to birth at home, protect women and families' rights to choose out-of-hospital birth, create an agency to provide regulation and oversight, and help achieve the best possible outcomes for mothers and babies. We believe that every woman has the right to quality maternity care, regardless of her chosen place of birth. And in order for this to happen, Kentucky must pass legislation to license certified professional midwives. If you have questions or are interested in getting involved with the Kentucky Home Birth Coalition, please visit our website at KentuckyHomeBirthCoalition.com or email us at info@KentuckyHomeBirthCoalition.com. Sign up for our mailing list and like our Facebook account so that you can stay up to date on our actions and progress as we work to license midwives in Kentucky. There's plenty of resources on our webpage, including resources on how to contact your legislators in support of licensing for midwives in Kentucky. Thank you for your attention and have a wonderful day.